Hi, I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today, I'm answering a viewer question to talk about conversion disorder. Conversion disorder is also called functional neurologic symptom disorder, and this is where you could have medically unexplained neurological symptoms. The symptoms are thought to have a psychological basis because not only are they not supported by any tests, they usually have a little something off about them, such that they don't really match up with the way the disorder normally presents. An example of this is pseudoseizures. Pseudoseizures are movements like convulsions, jerking, or falling that looks like a seizure, but there's no abnormal electrical brain activity happening. If you had an electroencephalogram, that's hard to say, also called an EEG, it would be normal. Now you may say, what if the EEG just isn't picking up the seizure activity? Well, here's one way that pseudoseizures don't match the normal way seizures look. A rule of thumb that cannot be broken is that once abnormal electrical activity crosses the midline and goes from one side of the brain to the other, you lose consciousness. That's a physiological fact. Consciousness turns off when there's generalized seizure activity. But often, people with pseudoseizures will convulse on both sides of their body while they're still awake. With the focal seizure, you have abnormal nerve firing on one side of the brain, and whatever part of the body that's being affected by that part of your brain, that part is what you see that's jerking. And often, focal seizure activity, though, will spread and eventually affect the whole brain. So someone may start out with just jerking or shaking of one side of their body, and then they may go unconscious and be jerking all over. Now, by the way, pseudoseizure symptoms are involuntary. People are not intentionally producing symptoms. About 5% of patients seeing neurologists present with these symptoms and have a negative workup. The term conversion disorder is based on the work of Sigmund Freud, who was an Austrian neurologist and psychoanalyst. The idea is that with conversion disorder, pseudoneurological symptoms arise when your mind converts unconscious psychological conflict into a physical representation of that conflict. Now, we've moved away from this Freudian conceptualization, but here's a classical Freudian example, and this is based on an actual patient, but the details have been changed. Judy is carrying her 2-month-old baby and hears the doorbell ring. When she rushes down the stairs, she slips on the carpet, but she tries to grab the handrail, but because she has a cell phone in her hand, she misses the rail, falls backwards, and lands on top of the baby. The baby screams so hard that her body jerks. Now, the baby turns out to be okay, but Judy is a wreck. She blames herself for not being more careful. The pediatrician, the family, everybody reassures her that accidents happen and that she can't blame herself for this. And this makes her feel a little bit better, but she can't get the image out of her head of her daughter's screaming face and jerking body. Weeks later, Judy starts to develop a spastic twitch in her arm and a tremor of her hand. And these episodes can last hours, and when it's over, her arm feels weak and numb for days. Judy thinks that this is happening because she suffered a head injury from the fall. She goes to see a neurologist and has a normal neurological workup, including a normal head scan and no seizure activity. But these normal tests don't really change anything for Judy. In fact, the episodes get so out of control that she doesn't even feel safe to take care of her child anymore. So mother-in-law comes to the rescue, and Judy continues to get worse, spending most of her day either spastically twitching or recovering with weakness the whole next day, which has now become full left-sided weakness. She was then referred to a psychiatrist for treatment. The psychiatrist prescribed an antidepressant because at that point Judy was depressed and anxious with a lot of ruminations about what's wrong with her. She was convinced that she had an undiagnosed brain injury and that no doctor could diagnose it or find it. She also believed that the brain injury was progressive and that she was probably going to end up in a wheelchair. So here's what happened to Judy. The antidepressant only helped a little bit with her mood and anxiety. She still had these attacks that made her poorly functional and unable to take care of her daughter. With psychotherapy, the psychiatrist learned that the night before the fall, Judy and her husband had an argument about her phone. He thought that she spent too much time on her phone, and the last thing he said was, "You're a mom now. You need to get off social media and pay attention to our daughter." This made her feel very guilty, like she was a bad mom. But social media was her outlet. It's not like she was on it all the time. That was association number 1. Her phone was a sign of negligence. So the story continues. On the day of the fall, just before the doorbell rang, she was getting ready to check her Instagram notifications because she had just posted a cute picture of herself holding the baby. So she figured she'd take the phone downstairs with her to use after she answered the door. Association number 2. If she had listened to her husband and put the phone down, she would have a free hand to catch herself on the stairs. Association number 3. She had never seen her baby cry that hard and see her body jerk with screams, and that made her worry that the baby was having a seizure. She couldn't get that image out of her head of her baby screaming with those sweet gums exposed and her body jerking. That image was just seared in her mind. And she was convinced that she caused the baby to have a head injury. Now, the psychiatrist helped Judy make these associations between her guilt, her belief that she witnessed her daughter have a seizure, and her belief that she caused her daughter to have permanent brain damage. Judy converted all of those unacceptable thoughts into physical symptoms that looked like a seizure and brain damage. And it just so happens that the arm that twitched and jerked was the same arm that held the cell phone that failed to grab the handrail. Seeing these connections helped Judy see that her anxiety and worries were causing the symptoms, but the symptoms still didn't go away completely. It wasn't until she had some hypnotherapy that she was able to get control of the symptoms. They mostly resolved, except for occasional times when she gets stressed out and have a mild hand tremor. Now, that's a very psychoanalytic interpretation of Judy's physical symptoms. Not every conversion disorder is this dramatic, but it can be, especially if the person has a mixture of symptoms that affect different neurological domains. There's 8 types of conversion disorder. You can have conversion disorder with weakness or paralysis, or with abnormal movements like tremor, stiffness, or walking problems. You can have the type that causes swallowing problems. Some people can feel like they're having attacks of their throat closing. You can have speech symptoms like having slurred speech or trouble producing speech. You can have attacks or seizures. You can have sensory loss, like you can't feel parts of your body or have numbness in certain parts of your body. And then you can have special sensory symptoms like smelling unusual odors or having visual disturbances like flashing lights or seeing spots. And then there's mixed symptoms. Judy would be an example of conversion disorder with mixed symptoms because she had a combination of weakness, abnormal jerking movements of her arm, and a tremor, along with some numbness. So she had a lot. Conversion disorder can be something that pops up under certain circumstances, then goes away. It can also be persistent and come and go over the course of your life. People with conversion disorder can experience dissociative episodes where you feel disconnected from yourself or your environment. Depression and anxiety commonly occur with conversion disorder, and sometimes treating the depression or anxiety can help the physical symptoms go away. But sometimes it takes more intensive psychotherapy to resolve the conversion symptoms. Hypnotherapy may be useful as it was with Judy. You usually need to see a therapist who performs a session, but you can learn self-hypnosis exercises to use later when you're no longer in therapy. Watch this video for more on dissociation. See you next time.